Welcome back to the EMT Spot's Blood Pressure Podcast. I'm Samuel Harrison.
And I'm Olivia Harper.
And we're ready for another deep dive.
Absolutely.
Today we're going to be talking about ARBs.
Angiotensin II Receptor Blockers.
Yeah, it's really something to consider. How many people around the world are affected by cardiovascular disease?
It really is.
And it shows how important it is to understand the tools that we have available to us to fight back against it.
Absolutely. And understanding medications like ARBs is a really good step in that direction.
So let's start with the basics.
Okay.
What exactly are ARBs?
So ARBs are a type of blood pressure medication.
Okay.
And they work by blocking the action of a hormone.
Oh, interesting.
Called angiotensin II.
Angiotensin II.
Yeah.
Okay.
And that hormone...
So what does that hormone do?
It constricts your blood vessels.
Oh, okay.
And raises your blood pressure.
So it's one of the bad actors.
It is one of the bad actors when it comes to high blood pressure.
Okay, now how are they different from ACE inhibitors?
So ACE inhibitors and ARBs both work in the renin-angiotensin-aldosterone system.
Okay.
But they do it in slightly different ways.
Okay.
So think of your blood vessels as a highway system.
Okay.
When your blood pressure's high, it's like having a traffic jam on those highways.
Mm-hmm.
Everything is constricted.
Everything's under pressure.
And under pressure.
Yes.
ACE inhibitors and ARBs both help ease that congestion.
Okay.
But in slightly different ways.
I'm very curious. Tell me more.
All right. So you see there's this hormone in your body, angiotensin II.
Okay.
And it's a major culprit in raising your blood pressure.
Right.
So think of it as a mischievous road crew that goes around setting up roadblocks and narrowing those blood vessel highways.
Mm-hmm.
So ACE inhibitors, as their name suggests, block the production of angiotensin II.
Okay.
They're trying to stop those roadblocks from being built in the first place.
Okay.
Now, ARBs, on the other hand, work a bit differently.
Okay.
They're like traffic directors who stand at those roadblocks and redirect traffic, preventing the congestion from getting worse.
Oh, so they block the effects of angiotensin II.
They do.
Rather than preventing its production.
Exactly.
Oh.
By blocking the receptors that angiotensin II would normally bind to ARBs, effectively relax and dilate those blood vessels.
Right.
Easing the pressure and improving blood flow.
Now, what are some of the benefits of using ARBs compared to other blood pressure medications?
Well, there are quite a few reasons why ARBs are so popular.
Okay.
For starters, they're really effective at lowering blood pressure.
Okay, good. That's what we want.
That's what we want.
Yep.
But beyond that, they've also been shown to protect vital organs.
Such as?
Like your heart and kidneys.
Important stuff.
Very important.
Yes.
From the damaging effects of high blood pressure.
So it's not just about the numbers on the blood pressure cuff.
No, it's not.
It's about protecting your overall health.
It is.
Long term.
Precisely. And one of the things that makes ARBs particularly appealing is that they tend to have fewer side effects.
Okay.
Compared to some other blood pressure medications.
Yeah.
You know that annoying dry cough?
Oh, yeah, I've heard about this.
That some people experience with ACE inhibitors.
That sounds really unpleasant.
It can be. And luckily, that's not a common side effect with ARBs.
Oh, good.
They're generally well tolerated.
Okay.
Which is a big plus for patients.
So it sounds like ARBs have a lot to offer.
They do.
But I'm curious, are all ARBs created equal?
That's a great question.
Or are there different types to choose from?
There are actually several different types of ARBs available.
Like what?
Each with its own subtle nuances. Some of the common ones are losartan, valsartan, irbesartan, telmisartan,
Think of a family.
olmesartan, candesartan, and eprosartan.
Wow.
Yeah, there's a lot of artans out there.
It's like the whole family of them.
It is, and while they all work in essentially the same way, by blocking those angiotensin II receptors, they might have slight differences in their dosing, how long they stay active in your body, or what specific conditions they're best suited for.
So if someone needs their blood pressure to stay stable throughout the day, might their doctor prescribe a longer-acting ARB?
Exactly. That's a perfect example. Losartan is often a great starting point, but if you need something with a longer duration of action, your doctor might suggest something like telmisartan.
Interesting.
It's like having different tools in a toolbox, each designed for a specific purpose.
This is why having a knowledgeable doctor to guide you really comes in handy, wouldn't you say?
Absolutely. Your doctor will consider your individual needs, your medical history, your lifestyle, and any other medications you are taking to determine which ARB, if any, is right for you.
So it really is about finding the best fit.
It is.
For your own unique situation.
Exactly. It's not a one-size-fits-all approach.
Right.
Now, while ARBs are generally well tolerated, it's important to remember that all medications can potentially have side effects.
Right.
Some people might experience dizziness, fatigue headaches,
Yeah.
or even nausea.
And this is why that open communication with your doctor is so crucial.
It is.
So they can monitor how you're feeling.
Correct.
And adjust your treatment plan as needed.
You got it.
So, make sure you talk to them about all these things.
Yes, and tell them if you experience any side effects.
And speaking of things to watch out for,
right.
There are also some potential drug interactions.
There are.
To be aware of when taking ARBs.
Absolutely.
Okay, for example, taking ARBs alongside NSAIDs like ibuprofen or naproxen might reduce the effectiveness of the ARB.
They might?
In lowering blood pressure.
Yes.
So if you're taking an ARB and you need pain relief, you need to talk to your doctor about
Absolutely.
which pain relievers are safe to use.
Precisely. They can recommend alternatives.
Okay.
Or adjust your dosage accordingly to ensure that you're getting the best possible care.
Another interaction to be aware of is with potassium-sparing diuretics.
Yes.
Like spironolactone.
Yes.
Combining these with ARBs can sometimes lead to high potassium levels.
It can.
Which can be dangerous.
Yes.
Okay, so avoiding those combinations is key.
It is.
Are there any other interactions we should be aware of?
Well, ARBs can also interact with lithium, a medication used to treat certain mental health conditions.
Okay.
So if you're taking lithium, it's vital to let your doctor know before starting an ARB, as the combination can potentially lead to lithium toxicity.
Oh, wow.
And speaking of interactions, it's also important to be mindful when combining ARBs with other blood pressure medications like diuretics or calcium channel blockers.
Right, because that could really make your blood pressure plummet.
Exactly. While using multiple medications can sometimes be necessary to achieve optimal blood pressure control.
Right.
It's crucial to do so under the careful supervision of your doctor.
Hmm.
They can monitor your blood pressure closely and make adjustments as needed to ensure your safety and well-being.
It's all about finding that sweet spot.
It is.
That balance.
That perfect balance.
Now, before we move on, let's talk a little bit about how to use ARBs safely and effectively.
Right.
So what are some tips for those who are prescribed an ARB?
First and foremost, always, 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 always follow your doctor's instructions.
Good advice.
Never try to self-medicate or adjust your dosage without consulting them. Never try to self-medicate or adjust your dosage without consulting them.
Good advice. It seems like common sense.
It is, but sometimes people think they can.
Try to take things into their own hands.
Yeah, exactly. So it's always best to consult with your doctor.
Right. And remember, consistency is key.
Consistency is key.
When it comes to taking ARBs,
absolutely.
They're typically taken orally once a day.
Right.
And it's best to take them at the same time each day.
Yes, to maintain that steady.
To keep those levels steady.
Level of medication in your system.
So if you're a creature of habit like me, that shouldn't be too hard to remember.
It shouldn't be.
What happens if you do miss a dose?
Well, if you miss a dose, don't panic.
Don't freak out.
Don't freak out.
It happens.
Just take it as soon as you remember.
Right.
Unless it's almost time for your next scheduled dose.
Yeah.
And whatever you do, don't double up.
Right.
On the dose to try to make up.
More is not better.
For the missed one that can potentially lead to problems.
Right.
So just stick
to the schedule.
Your schedule as much as possible.
As much as possible.
And speaking of staying on track, it's incredibly important to attend those follow-up appointments with your doctor. You know?
Got to go to those checkups.
They need to monitor your progress.
Yeah.
See how the medication is working for you.
Make sure everything's going okay.
And address any side effects or concerns you might have.
It's like having a check-in with your health coach.
Yeah, I love that analogy.
Making sure you're on the right path.
It really is a partnership.
Yes.
You and your doctor working together.
Working together as a team.
To manage your hypertension.
And before we wrap up our discussion on ARBs, let's reiterate why it's so crucial to consult your doctor.
Yes.
Before starting this type of medication.
You're absolutely right.
Because like we said, they're powerful.
ARBs are powerful.
They're not a one-size-fits-all solution.
No, they're not. Your doctor is the key to determining if an ARB is the right choice for you.
They'll look at your individual history.
Your medical history.
Your current blood pressure levels.
Your lifestyle.
All those other factors we've discussed.
All of those factors, to create a personalized treatment plan.
They'll look at the big picture.
Exactly.
Not just a single snapshot of your health.
Precisely. It's about a holistic approach to well-being.
Well, on that note, I think it's time for us to wrap up this deep dive.
Already. It feels like we just scratched the surface.
I know, right?
But I think we've covered a lot of important ground today, Eddie.
We have. Before we go, do you have any final thoughts for our listeners?
I do.
Maybe something to ponder.
Yeah.
As they continue on their journey toward better heart health.
You know, as we've been discussing ARBs and all their complexities,
yeah.
What's really resonated with me is the importance of being an active participant in your own health journey.
Yeah.
It's not just about taking a pill.
Right.
It's about understanding how your body responds to different treatments and lifestyle changes.
So it's about taking ownership
of
your health and being informed.
Exactly. And perhaps, as a final provocative thought for our listeners, consider this.
Okay.
We focused on ARBs as a specific tool, but the real challenge and opportunity lies in understanding the complexities of your own body.
So true.
Yeah.
How do you respond to different lifestyle changes?
Exactly.
What are your unique risk factors?
What works for you might not work for someone else.
Right.
And vice versa.
Those are great questions. And where can our listeners go to explore those questions further?
Well, their doctor can be an invaluable guide on that journey.
Yeah.
Don't be afraid to ask questions.
Right.
Advocate for your needs.
Yeah.
And engage in open and honest conversations about your health.
It's a partnership.
It is a partnership after all.
It is a partnership after all.
It really is.
Yeah.
You know, we all have unique bodies.
I do.
And what works for one person
right.
might not work for another.
Exactly.
So it's important to find what works best for you.
It's about personalized medicine.
It is.
Yeah.
And it's about being an active participant in your healthcare.
Right. So you're not just passively taking whatever you're given, but you're actually understanding and advocating.
Asking questions.
For yourself, yeah.
Doing your own research.
This has been really insightful.
Yeah.
I feel like we've covered a lot of ground today.
I agree.
And I think our listeners are going to come away from this with a much better understanding of
ARBs. And how they work.
So before we sign off,
yes.
Any last words of wisdom for our listeners out there?
I think the most important thing is to remember that you are in control of your health.
That's a good one.
And don't be afraid to take an active role in managing your blood pressure.
Awesome. Well, on that note, I think it's time for us to say goodbye.
Okay.
I'm Samuel Harrison.
And I'm Olivia Harper.
And this has been the EMTSpot's Blood Pressure Podcast.
Thanks for tuning in.
Be sure to subscribe,
like, and share this episode with anyone who might benefit from it.
We'll see you next time.
Stay healthy.